Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. So last week I did upload a video on how to go through your resume and your cover letter to make it as, amazing as possible, because there's a lot of people out there who need a job, who are looking for one, and offices get tons of resumes. I know the office that I'm at, we get tons, and we take 2 seconds to look at it maybe. And if it's not up to par, we don't look at it again. So it does help to have an amazing resume and cover letter. So if you haven't seen that yet, then have a look. I did upload the video last week. You should be able to do a search for resume help and cover letter, and that should help. There's a separate video for the resume, and there's a separate one for the cover letter. But today I want to talk to you guys about the interview now, because that goes hand in hand. Even if you have an amazing resume and cover letter, you will have to have an interview at some point. So you might be wondering how that works. Even if you've had tons of them in your life, being at an interview for a dental position is completely different than being at an interview for Subway, for Pizza Hut, for McDonald's, for Tim Hortons, whatever. I had my first dental interview as a dental assistant when I was 19, and we didn't have a class that we could take to help us. I had no idea what to expect. I had only been on one interview before when I was 15, and that was for Subway, and I got the job right away. So I didn't really have any real experience doing an interview, and needless to say, I did get the job. So I was like, yay! But now that I'm older, even when I started to go for interviews again, because I was at the same office for 13 years, when I started to go for interviews again because I was looking for something a little bit less than part-time, I didn't know what to expect, because you hear all kinds of things. I did sit on a few interviews at my other office, but it was pretty easy, pretty laid back, and not all offices are like that. There are some offices where you will be interviewed with other people. I haven't had that experience, but I have heard of it. It can obviously be very overwhelming. You're nervous to begin with, so then to be interviewed with a bunch of other people, it's kind of like, oh my gosh. But if that happens to you, use that to your advantage, because think, other people are going to be nervous too, just as nervous, if not more. So the way to take charge of that situation, if you're in a room with 2 other people, 10 other people, 20, is to take charge. Be outgoing. Even if you're nervous as heck, even if you're a shy person, be outgoing, because you will stand out. Those shy people, those quiet people will not stand out. Those people who answer questions only if they're asked a question will not stand out. You have to be outgoing. Usually what they do, from what I've heard, is they will tell a bunch of people to meet at the office or, at a certain place. It's even been a boardroom in a hotel room, I have heard. So you will go in, you will sit there, and you'll all be kind of looking at each other like, oh, are you all here for the interview? I didn't know they were interviewing other people. Take charge right away, because you don't know who might be in the room. It could be a dental assistant who works at the office, who's just sort of seeing how people interact with people they don't know, because how they see it is, oh, well, they'll be seeing patients that they don't know every single day. Are they going to be shy, quiet, or will they make a conversation? Will they be able to talk about crowns? So somebody may be watching. So even as soon as you walk in, say, hey guys, is everybody here for the interview? Oh my gosh, there's a lot of people here, something like that. Say, oh geez, is everybody here for the interview? I thought I was going to be late because I got stuck in traffic again. Come up with something. And then people will be so happy that you're talking, because they're all thinking, oh my God, all of these people are here for this interview. I'm so nervous. So they will be happy that somebody's talking. And then when the interviewer, it could be one person, it could be 2, it could be 3, come into the room, they will likely see you are the one talking. You are the one interacting, and they like that. They will remember you. So typically how these work is they will just ask people questions like, sometimes they have you fill out a form, like a personality test. And other times they will just ask questions such as, who here has been a dental assistant first? Oh, I have, tell me about your experience. I know it sounds nerve-wracking, but I think that they do this because they may have so many people that they have to interview and so many people that they want to, that it's just easier for them, and they're able to talk to everybody a little bit instead of booking like 10 or 20 different appointments to see 10 or 20 different people. So I think that's why they do it. I don't think it's very nice because a lot of people would be nervous from that, but if that happens to you, again, the moral of the story is to take charge, okay? I know that may seem hard, and if you need help with that, let me know, but that's what you have to do to get noticed. But typically, interviews they will simply call you up. They may talk to you a little bit on the phone and say, hey, are you available to come in Wednesday morning? Yes, I am. Okay. So first things first is what to wear. Okay. I have seen so many people. I used to work at a dental office in the mall. I actually saw people come in with shopping bags. Okay. They may have looked the part. They may have looked amazing, but they came in with 6 or 7 or 1 or 2, it doesn't matter, different shopping bags. And don't do that. If you're shopping before the interview, if you're doing anything before the interview, put it in your car before you go in for the interview because it looks sloppy. Okay, so rule number 1. I would have thought that would be obvious, but I've seen more than one person do it. And look the part. Again, I would have thought that this is obvious, but maybe if you've never been to an interview before, you just simply don't know. I'm not saying you have to wear a evening gown or a tuxedo or something, but wear nice black pants. Black pants or, a nice pair of pants where, even a cardigan like this is nice. What I wore to my interview was black pants. Shoot, I should have shown you guys. Actually, I'll show you guys maybe, oh no, I might not be able to find it because we are packing to move. So I doubt I have that still in my closet. But like black pants, a nice top, and a blazer, even like a cardigan like over top so you look nice. Put on some makeup. Don't put on, like bright red lipstick, blue eyeshadow. That's pushing it because you do have to think you'll be working in the office. So, they may not be able to look past your bright red lipstick and purple eyeshadow. Even if you wouldn't wear that at the office, they may go, oh, wow, she's like overdone, so she may not realize that she shouldn't look like that at the office. It sounds bad, but it's true. Wear nice makeup, hair up or down. I don't think that matters. It's just, look nice, look professional. It's more so what you wear, I think. If you show up in a maxi skirt and a tank top, they're not going to take you seriously. You may have the most amazing resume. You may sound amazing, but if you're wearing, a skirt and a tank top, they're not going to take you seriously. If you're wearing bright red lipstick and purple eyeshadow, they're not going to take you seriously. I can't say that because maybe offices don't care, but I'm just kind of telling you guys the offices that I've been in, they would care. Okay, so leave your shopping bags, your leftover lunch, in the car. And always have your resume and cover letter with you in case they want to see it, because it has happened where they will say, I lost your cover letter and resume. Do you happen to have one with you so that we can go through it? So it just helps to have one. But yeah, so if anybody has any questions about that, let me know. But I think it's pretty self-explanatory. Look nice. look nice, you know, have nice shoes on, you know, don't have any holes in your pants, something like that. And arrive early. Do not arrive on time. Do not arrive late, especially. But things happen. If you are going to be late because you're stuck in traffic, there was an accident, you know, something, things happen, call the office. If you have to pull over, call the office, you know, say, hey, I apologize. I'm coming in for the interview today at 2 o'clock. I might be 10 minutes late. I'm not sure. I'm stuck in traffic. I was not expecting this. Is that okay? Or would you prefer me to come at a different time? You know, it's like, do not feel bad calling if that happens, but hopefully that won't happen. Even I had some interviews out of town. I planned to be there half an hour early. Yes, that's early, but at least if anything happened, then I did have that half an hour time, because I like to show up about 15 minutes early, okay? But let's just say something happens, there was traffic, then allowing myself the extra 15 minutes helps. Even if I'm half an hour early, I don't see them at that time. I'll sit in the car for like 15 minutes and then I'll sort of walk in. So it does help to be early, because if you're late, that's not obviously showing a good impression, right? So look the part, be early, have your resume. But now you're all probably wondering, what kind of questions will they ask me? So let me tell you. The main one they seem to ask is, what are some positive things about you and what are some negative things? That seems to stump a lot of people, and I'll tell you why. Because they don't want to sound like they're, you know, talking up of themselves, but they don't want to sound too negative either. So what I do is I turn a negative into a positive. So let me tell you what I'll do. Because if you say, oh, well, I can't think of anything negative, that's kind of a hard question, you know. They'll go, okay, you know what, fair enough, but they're asking you these questions to see your answers. They want to see sort of how people talk, how people interact. So turn a negative into a positive. So what I like to say is, I'll say things like, my negative would have to be that I'm too nice to patients. You know, if they're late, I'll be tempted to see them. You know, if they are talking to me for 15 minutes about their life and I'm thinking, okay, I kind of got to get started now, you know, but I will let them talk because I am too nice. Or, you know, when a patient's having a hard time with the x-rays, you know, ow, 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 I'll probably take too much time to talk to them and say, well, we do need the x-ray for, you know, this and this and this. I'm not the type of person to just kind of shove it in there, even though sometimes I probably should. But so I'd have to say that that's a negative. See how that sounds positive? If I was listening to that, I would go, okay, so she's too nice to patients. I like that. Because patients will come back if you're nice to them, plain and simple. And the office does not want to hire somebody who's mean to patients. The office will not hire somebody where after the appointment, the patient says, she was brutal. Oh my God. Like, she yelled at me for not using the toothbrush every day. She yelled at me for not flossing. I am not going to come back here. Okay. People like nice people. So you see how I turned a negative into a positive there? So those are some examples. I'll try to think of some other examples, but those are the ones that I typically use. And positives are, you know, easy. A positive could be, I love what I do. I love being able to talk to patients. Like, I could probably talk to patients all day, every day. I love educating the patients about their oral health. And if we want to go to another side of things, a positive thing about me is I am always on time. I do not like being late, so technically I'm early. And I won't leave until something's done. So if it takes me a little bit longer to clean up the room, you know, I will make sure to do a good job. If cleaning takes me a little bit longer, that's okay. You know, I prefer to do that. You know, I find a positive, they're usually easier to talk about. So if you guys have questions, let me know, because I don't think that you can sound too positive, if that makes sense. A positive that I typically use is, well, a positive thing about me is that I've been tutoring now since I was about 19, so I can talk about likely any you know, questions that the patient has. Like if they have an oral pathology question, like, oh, I have this lump over here, you know, any ideas what that could be. Whereas if a student's new, or even if they've been practicing for 20, 30 years, a dental hygienist may not be up on their oral pathology, so they may have a hard time answering that. But I would be like, oh yeah, I know exactly what that is, or I have an idea, you know. It's not something that I would be concerned about, but you should still show that to the dentist, so let's talk to him or her, you know. So that's my positive, is that I am a tutor. I've also been a restorative hygienist for 2 years, so I use that also as a positive. You know, like if a patient comes in and says, I had my tooth fixed about 3 days ago, but it kind of feels high, you know, is there anybody available to help with that? Well, I can help with that, you know. So those are the positives that I use. A positive that you could use is, let's say you have experience working at Tim Hortons. That's a positive, you know. Say, well, I have experience working with all kinds of people. You know, I used to work at Tim Hortons, you could say, and say, you know, people get very upset over not having the right coffee, which is crazy, but they do. So I do have experience with working with difficult people no matter what. You know, the customer, the patient's always right, even when they're not. But I do have experience talking to people like that. So you see how, use a positive that is for you. So it's usually towards any work experience you have. If you're a student, or if you say finished school like a month ago and you haven't had any experience yet, use that as a positive. Say, well, you know what? I have not worked in an office before. I see that as a positive because you can train me however you want, and I will just soak it up because I have nothing to compare it to. So does that make sense, you guys? So you see how turning any experience that you have is easily a positive, and any negative that you might have, turn that into a positive. Do not say things ever like, well, I tend to get sick a lot, or my kid gets sick a lot, so I may need to take time off, or I like to take a holiday, maybe once a month. Do not say things like that. Do not say, well, I like to take it off for my birthday. Is that okay? Yes, I have heard that before. Yes. And it's like, no, that's not okay. You know, we all do it. I take it off, but do I say that in the interview? No. Let me see. Yeah, I think those are pretty good. Okay, so the interview. Okay, so we talked about that. I'll talk about some other questions. Like they may say things like, why do you feel you would be a good fit at this office? You know, you might be saying, well, I don't know. I just want to make some money. Like, I don't know why I'd be a good fit. You know, just make stuff up. Sorry, don't make stuff up. But, you know, say things like, well, my clinical experience in college, you know, I love working with patients. I can see this is a large office, so I have a lot to learn, but I am excited because working with the patients, you know, working in a fast-paced environment, I love. You know, say something like that. So look at the office beforehand. See, is it a large office? Is it a small office? You know, they should all, or a lot of offices do have a website, so look at that. On the opposite side of things, if they have a small office, you know, say, you know, I have always wanted to work for a nice small office, you know, not too large, not too insane. So this is perfect for me. You're 10 minutes away from my home. So if you ever need me short notice, like that would be perfect. So I can't complain because this would be awesome. You know, say you are offering full-time hours, so that's perfect for me, or you are offering part-time hours, so that's perfect for me. You know, you're open Saturdays, I don't mind working on Saturdays, or say, you know, you aren't open on the weekend. So that is perfect for me because I would prefer to work Monday to Friday, you know. So look at the office and pick apart things to make it specific to them. And they will appreciate you have looked at the office ahead of time. So yeah, so those are some common questions. Let me think of some other common ones. Those are probably the main ones. And they will ask you guys at the end, do you have any questions? Ask questions. I know it sounds silly, just pick something and ask. You know, things that they may not have talked about. You know, ask things like, do you have a lot of patients who come in every 3 months, you know, 6 months? Is it typical for most of your patients to come in every 6 months only? Or is it typical to talk to every patient as to why they should be coming in every 3 months if they need it? You know, ask something like that. Ask things like, do you like us to come in half an hour before the first patient? 15 minutes, you know, like what's the office policy for you? Yeah, things like that. The questions that I typically ask are, do you have the digital x-rays, or do you still have the old system? Ask things like, I'm assuming we would be the ones to sterilize our own instruments, or do you have somebody here? You know, just ask anything. I don't think there's a wrong question, except for if you're asking things like, so if we call in sick, who do we call? Because they don't want to hear that. Or, so if we need to take like time off, who do we call? No. Or, so if we need to take time off, how much notice do you need? You know, don't ask things that would make you look bad, okay? You calling in sick, you asking for time off makes you look bad, okay? It's not a bad thing, but I always tell people that if you're working somewhere new, don't take time off and don't call in sick. Actually, I do have another video about calling in sick, so you should watch that one. I'm not saying call in sick if you're don't call in sick, like if you're sick, but if you can handle it, don't call in sick or take time off if you're new, okay? But I do talk about that in another video, so that's for another time. But okay, guys, so I don't want this to be too long. I'm sorry. So hopefully I still have everybody's attention. I do hope that that helped with the interview process. It's not hard, actually. I love the interviews because that lets me sell myself to them, if that makes sense. Because otherwise, you're a person on a piece of paper, and that's it. But as soon as they meet you, act excited, act passionate. You know, even if you're shy as heck, try not to be as shy. I know it's easier said than done because I'm not shy, so I don't understand that per se. When I was 19, though, I was shy. Now I'm not. But if you're shy, you know, try to come out of your shell a little bit. Act enthusiastic, act happy. Do not act like, well, some of my positives are that, you know, I love to work. I love my patients so much. And, you know, I just can't imagine life without patients. That sounds really funny. Don't act like that. Or, you know, don't be overly like, oh my God, like I love the patients. I love to work. It's like the most amazing thing ever. Like, oh my God, don't act too excited. I know it sounds funny. Have energy, but not too much energy. Be yourself, but don't be too shy. Don't be too quiet. Does that make sense, you guys? Okay, so if you need help, though, let me know, of course. I will post the video shortly because I know people are super excited to see it. So thank you for watching, and I'll see you guys in the next video.